Now, as global concern for the spread of the coronavirus rises, a Stellenbosch University virologist has urged South Africans not to panic. Professor Wolfgang Preiser returned from Brussels this week, where he was invited as an expert evaluator of coronavirus research proposals. The South African Medical Association has already warned that it's not a case of if COVID-19 arrives on local shores, but when. Preiser says the country must be prepared. ENCA's Barry Bateman has the story.
The number of people infected with COVID-19 continues to rise. Globally, about 85,000 people have tested positive for the virus. 2,900 have died. What started in China has now spread to 59 other countries, and it's only a matter of time before it arrives in South Africa. This strain of the coronavirus is considerably less lethal than SARS, which killed 1 in 10 people during the 2002 outbreak. So how should the public respond to the worldwide outbreak of a new illness?
Could you say that we're dealing with just a really bad case of the flu? And should people panic?
For all intents and purposes, I think the comparison with the new flu strain is probably not that wrong. And that means panicking is definitely not advised. And in fact, what happens is people who panic tend to make mistakes. So what we are seeing now in many places and, very industrialized countries is that people are stockpiling masks and hand disinfectant and other things that may then be missing for those who need it, those who really have sick relatives to care for. So that is not a good approach. Actually, so no panic buying and things like that.
Like with influenza, there are certain members of the public who are at particularly high risk. It is these people, Professor Wolfgang Preiser says, would need special attention and care.
I don't think we have a complete picture yet of how the new virus behaves, but from the publications that have appeared so far, it seems that it is the elderly and the chronically ill who are most badly affected. So those are the patients who will need intensive care unit treatment and who may actually die due to the infection. The younger people and those without chronic illness seem to do much better.
The National Institute of Communicable Diseases says it remains on high alert. It says measures are in place to detect and manage the disease should it reach South Africa. For more information, log on to the NICD website. Barry Bateman, Johannesburg.